Ladies and gentlemen, good day. I am your host, Rudy. Thank you for standing by and welcome to Esri India on Esri GIS tools, template and free resource for COVID-19. In today's webinar, we will learn more about Esri's ArcGIS Hub Coronavirus Response Template, workflows supported, and how agencies can configure it to engage, collaborate, and share near real-time data with citizens and decision makers. The speakers for today's webinar is Mr. Ashish Dhawan. Ashish Dhawan is presently working as Divisional Manager Pre-Sales at Esri India. Over 20 years, he has worked extensively in supporting customers in enterprise GIS implementation across various industries with a special focus of public safety domain. Currently, he is a part of Esri India's COVID-19 task force, which is supporting customers across India in their COVID-19 response initiatives. For the duration of presentation, all participants' lines are in listen-only mode. We will also have a panel of Esri India experts on call to answer any queries you may have. We will have a Q&A session post the presentation. Meanwhile, if you have any questions, you may also send them across to all the panelists using the chat window on the right-hand side of your console. In view of COVID-19 lockdown, our teams are hosting this webinar from their home environment. We have planned this event to ensure minimal disruption to the service during the event for your seamless experience. In case we face any unexpected disruption, please be patient and we would take necessary steps to restore the service immediately. So now, without any further delay, I would like to hand over the proceedings to Mr. Ashish Dhawan from Esri India. Over to you, Ashish.
Thanks a lot. Good morning, friends. We very well understand that thanks very much for joining in this webinar session where we would be walking you around these options where we will be helping you go around the GIS tool, templates and resources which we are offering for COVID-19. We very well understand that you have been taking out your precious time from your home and trying to join this. So without wasting any time, I will be going ahead and walking you through this presentation. We very well understand today that the world and India especially is also going through this COVID-19 pandemic, which is a major public health challenge globally. And Esri India, what Esri India has done is it would like to extend all its services to all the organizations in India to help you use its resources and also to share your information to different organizations. How we will be able to do that, we will be walking you through that. The very important thing during this pandemic session is that we very well understand there are lots of people who are there, who are working from homes, who are there in the field, who are there people who are working from hospitals day in, day out. There are people who are working from the governments, who are the community leaders, who are actually working from their places. Everybody needs information. Information is a major challenge for doing any activity, especially for decision making. So how Esri India templates are going to help during this pandemic, we will be talking to you on that. So we very well understand that there will be multiple citizens, multiple city staffs, multiple people who will be working on this stuff. So the next thing which is very important to understand is that whatever we are doing, it should be easily available. It should be available for easy to use, so that at this time we should be able to share the information as soon as possible, and we should also ensure that whatever data we are sharing, it should be authenticated. It should not be that the data is not valid and we are still trying to just share it. So the first important thing which we should keep in our minds is the data source which is coming to us. It should be a validated data source. The second thing which we should keep in mind is that whatever data we are sharing, it should be easy to use. The community with whom we are sharing, they should be easily be able to use it for their strategic decision makings and for their implementation strategies. What Esri India has done, especially for this statistic, is we have shared a URL which you can see on your screens, where you will be easily able to see that if you have, which talks about www.esri.in/en/in programs disaster response /corona impact 2020/overview. What it does is it gives you a web URL, a link where you can go, you can see whatever information we are sharing, you can go through that. The second thing what we are doing is all the organizations who want to get attached to us with Esri India and who want to share their information with public and who want to use their data to be shared for their India level, whether it's your India level data or state level data or district level data. If they want to share it, they can always come back to us. We will be enabling them with different resources in the shortest possible time to ensure that the data can be disseminated to all the relevant stakeholders. What we have also done is the configuration is so easy that it's totally upon you, that you can decide to which department you want to share the data, and if you want to make some of your data public, you also have the options of making your data public. So once you go through the URL, you can, when you scroll down, you will be there will be an option where you can see there's a request assistance. When you click on this, it asks you for your company details and the person who is going to contact us and what kind of assistance is required from Esri India. Esri India is giving you for next 3 to 6 months. What it is doing is it's going to give you a ArcGIS online stuff where a hub kind of a scenario where we will be having multiple templates. Esri India team will be helping you configure that. And whatever data, as I already told you, that one of the important things what Esri India is also ensuring is that whatever data is being shared, it should be authenticated. So we will also be looking at whatever data you are sharing. We will be asking the details of the data, the kind of data you are sharing, from which departments you are trying to take that data. That authenticated data will be used on our templates and will be shared to the different, if you want to share it within your department, you can do that. And if you want to make some data as public, you will also be having options to make your data public. If you go to the site, the very first thing which you see is that you will be going through the dashboard which is shared by WHO. Then we have also worked along with Esri globally has worked along with Johns Hopkins University, where it has tried to share the global level data with all across the world, where you can actually go to the country level data and see the details. Once I finish with my presentation, I will also be walking you through these demos. So apart from the Esri initiative, we have extended this Esri initiative in India. The first thing which we had done at India level was we attached with NDMA and took the data from ICMR, and all the data which was coming from ICMR has been put into this dashboard so that we can share the information related to India for Indian people, so that they can actually get to know the details of each and every state and the kind of scenarios they are going through. So what is required for this? The first thing what is required to get started is we should know what kind of data you have, which we have already talked about. Once that data is coming, we should be able to give that information into our templates. Our Esri team will be helping you do that. And then once that data is updated, you will be able to share those data to your different organizations and stuff. So there's a total level of 5-step process which is required during this. The first thing what is required is map your cases. What it means is you should be knowing what the number of cases which are spreading, the total number of cases which are coming in the states or India or globally. The second thing which we should know is map the spread, the kind of spread, how it is spreading, how the disease is spreading, and how it's increasing day by day. The third thing which we would like to understand is the vulnerable population, because we very well understand that the coronavirus, which is actually hampering is, as per the data which we have received, what people are analyzing is that there are lots of vulnerable population who is getting attacked by it. So what we can do around it. The fourth thing is the capabilities of how we can configure that and how we can use the public information which is there. So I will be talking in detail about these as well. And then once all this data has been configured, how you can communicate it using the different templates and the maps which Esri India is offering. If you can see, I will be going into detail of into each one of them point by point. The very first thing is map your cases. What is required is we should be, as I already talked about, we should be knowing about the data sources, where the data is coming from, so that we can get to know what are the active cases, what are the kind of facilities which are available, which are the hospitals, organizations, the details of organizations which are actually helping us, so that we can get to know what are the facilities which are offered, how many bedded hospital it is there, how many doctors are there who are facilitating it. So all this stuff is there in our Esri template. So the very first thing once we get attached to your organization is we need to take this information. We ask you to update this information with the help of Esri India tech support team. What we do is we take this data, we add that data, and we try to configure this data. So these data sources for the site which we are talking about, the first site which we had configured was for NDMA, where the data sets were taken from ICMR. Apart from that, what we had also done was that we had tried to work with many other states as well, and we have tried to enable them to put their data on as a state level data. I will be also walking through all those use cases and the demos one by one. So when we talk about the very first thing is, the first thing which we offer is the dashboards. If you can see the dashboard right now, this is a screenshot of the dashboard where you can easily see that for India level, as we have worked along with NDMA, we are trying to show what are the total number of confirmed cases, total number of record cases, total number of deaths which have happened. And then we also have a state level information where when we click on the states, we get to know how many cases in each state, how many number of cases are increasing on daily basis. So how this is helping the other agencies is you can actually get to know what is the kind of spread and what decisions they should take to ensure that the spread can be reduced and the calamities can be minimalized. The second thing what we have done is we are trying to map the spread. That is, we are trying to go to the state level. We are trying to see, and this is on the daily basis. So based on the organization which shares the data, it tells us how the data is coming and when the data is going to be getting updated by them. Once that data gets updated, we publish that data on a scheduling basis where we actually show them that how many number of patients are increasing on daily basis. This is not only relevant, the first thing is relevant to the number of cases which are increasing on daily basis, so that we can get to know how we should and what we should do for our planning activities. The second thing what we have done is we would like to understand the day-to-day changes, the day-to-day impacts which are happening, not only from the cases level, but also at the hospital level, how many new facilities are getting up on daily basis, to understand that if there is a new hospital which is now ready to take the cases for COVID-19, we can all that data is also getting updated on daily basis on the dashboard. So it's not only the total number of cases, but it's also related to the total number of health facilities, the total number of any other emergency services which are still on, which are going on. If anybody would like to update that data also into these dashboards, so on daily basis, that information can also be updated into our templates, and that data can be shared on these dashboards. As you already asked, all the people who are already using our templates, they will be they are already aware that these are very easy to configure templates. So the turnaround time for making these templates is just a couple of days, where the data is getting pushed into these templates and you can very well see the data. One of the examples which we are showcasing here on the screen is the time slider, where based on each date how many cases are increasing. You can just click on the time slider and you can get to know the details of each and every day changes which are happening for that particular, the kind of spread. The third thing which is required is the vulnerable population. We should be very much aware. We very well understand that for each, whether it's India level or state level, each community, each location is different. When it's different, we need to understand that how many people in that particular locality are older than 65 plus years of age, where we can very well understand that these people are more vulnerable. Then we also understand, this is just these are the few cases which, as per the information which we have received, that these are the cases, these are the population which are vulnerable. So apart from the age, the other people who are already having some medical problems, like people who are suffering from cancer, HIV, diabetes, they are also more prone to this disease because their immunity is really less. So these are the kind of population which are highly vulnerable. What Esri India offers is it also has lots of social public data which is available from authentic sources, which can be coupled with your templates, which will enable you to decide which are the more prone areas. We can actually help you create those hotspots, those places which are actually more vulnerable based on some of the criteria which we are talking about. Then we also understand that there are lots of homeless people who are there, and the density of population is also very high. Since we are talking about social distancing a lot, but for the places which are very, very densely populated, we very well understand that that kind of populations are very, very much more vulnerable. So all this data, whether it's coming from whether it's old age, whether it's people who are suffering from diseases, whether it's data talking about densely populated locations, all this data can be available. If it's not available, you can also, the state departments can also enable us to share that data with us, because they have the details of these figures. And we also understand that the census data is also helpful here. So all this data can be collaborated. This can be attached with the templates which we are sharing. And this can help you understand what kind of decisions should be taken for that particular locality to ensure and make sure that we can minimize the risk of spreading of COVID-19. This is one of the examples that once we take the social index of the census data from different departments, the health department, we can very well get to know which are the places which are more prone to that area. So the darker red regions tell us which are the localities where we should focus more, because either the population is more or the people who are suffering from some particular diseases is more. The color, so we very well understand the map spread based on the color of the circles, and the size of the circles tells which are the places where the decision makers should focus more on, to understand what kind of decisions they can take. The next thing which is important for us is the details coming from hospitals, coming from health systems, coming from different partners who are actually helping us to fight this. Like, we would like to have details for all the blood banks. We would like to have all the clinics which are actually helping us fight this COVID-19. We should be able to understand which are the hospitals which are giving us the beds, what is the number of staff which is available. And as the number of patients are increasing day by day, what happens is that we should be also, that data has to be updated on regular basis, so that we can very well understand which hospital is still available for us to push in more kind of people who are suffering from this disease. we should, what we have also done is, apart from the templates which I was talking about, the dashboard template, there is a mobile template like Survey 123 or Collector app, which can actually be given to the field users. Again, this is a very easy to configure apps. We have been working with many state departments where we have tried to configure these apps as well, where the field users go to the field rather than updating the details on their diaries and pushing the data once they come back to their hospitals. This is a system where whether you are in an online or an offline mode, you can very well push that data from your mobile devices and that data gets updated. The benefit of this is that if we have, suppose we have created a command and a control center where all this information is getting collated. So all this information gets updated into your command and control center. And once that information is updated, it can be a near real-time scenario, because if you are working in an offline mode, there can be scenarios where your networks are not that good. But as soon as you get back into connectivity, you just need to, by a simple click of a button, that data which you have collected from the field gets updated. The benefit of that is that as soon as it gets updated into your central servers, that information is passed to the other agencies, other stakeholders, who can very well understand that what kind of facilities, what kind of hospitals, what kind of people are there for them to help who are free. So you can actually optimize your resources to the best. Then if you have details of your testing centers, if you have details of the kind of supplies which you have, whether related to your medicine, whether related to your oxygen, ventilators, all these supplies, all these details, they just need to be provided to us so that we can configure it into our applications and share this information with the public using the templates which we have. So this is one example for utilizing this kind of data and showing it on the map, where it's not only giving you details of the number of cases, but it's also giving you details of the kind of hospitals which are available, the kind of ICUs which are available. You can very well see the pie chart at the lower, the donuts, where the number, the percentage is showing, where it can very well show that which, based on the number, the darker the color, you can get to understand that which hospitals are getting out of stock of a particular medicine or a kind of a particular resource which we are talking about. The only most important thing is that this data should be authentic so that it can be shared to the right persons, to the right stakeholders. And whatever data which we are sharing, again, I would like to mention that it's not only for the people who are sitting in offices, but the people who are, whether they are in the field, they can also utilize this data. They can open these maps, these dashboards on your mobile devices and get the updates wherever they are. It's not that you are sitting in your offices and getting the details. So this is also one very example of the same. And then the last thing, the fifth step, which we talk about, is that the templates which we are offering, it's those interactive web maps, the interactive dashboards, the story maps, which actually help you do different kind of activities. These templates, so like you use your WhatsApp, you use your any other social media platform where you just feed in your data and using few clicks you are able to share the information. Similarly, Esri India, Esri offers you these templates where you don't need to write a single line of code. You just need to configure your data with these web maps, with this dashboard, story maps, your mobile apps, and once they are, because it's more of a configuration, that is why we are able to deliver our solutions to the relevant stakeholders during this time in very few days. So we can help you deploy these applications. We can help you configure your story maps. We can help you consider your dashboards. We can help you configure your mobile applications as well. So once we have that, you can actually see it's an entire hub of templates, the hub which we are offering, which is not only enabling you to work around the impacted areas, but once we see that the lockdown period is slowly and slowly opening, what we can also do is we can actually put the data coming from schools, the data which is coming from some events which may start after some time, so we can actually give that data can also be configured in these templates, and we can share which events are going to be on, when are they going to be on, and how many people can attend. All that information based on the data can be shared and configured on these applications. So this application, again, I would say it's not only for your hospitals, it's not only for your people who are there sitting in offices, but it is also can easily be shared at community level also. So these are some of the other examples where we can actually configure them. It can also be configured for your airports. It can be configured for your food assistant information. We very well know that there are lots of schools in Delhi which are giving you assistance for food. So if we have the data for that, and if we would like to update that information related to the kind of schools where the food assistance is being offered, even that data can be plugged into our software. It's just that data should be authentic and it should be provided to us so that we can help you enable this onto your systems. So these are some of the field apps like Collector app or Survey 123 app. Again, easy to download, which can be easily configured with your templates. As I told you, Esri India is offering different organizations the option to collaborate with us, where we will be providing you the assistance. So these mobile apps we can help you configure these mobile apps with your application, with a browser-based application, and you can share your information. So what are the challenges to do this? Now we very well understand that and at the time where the lockdown is there, we very well understand that there are lots of challenges which the people are facing. The first question which might come into your mind is that whether we have the right kind of IT resources, the IT infrastructure which we can use to do this. Whether we need to spend time into development, or we can do it using simple configurations, and whether we can do it in the shortest possible time. So what Esri India has done is that since we are giving you an online platform, what we are doing is that the IT infrastructure is already Esri India is providing to us. For that, you just need to, the first slide which I told you about the resource request, where if you want to collaborate with us, you can just click on that request and you can request for us to collaborate with us and share this information with your organization or with the community. The second thing what Esri India is enabling you to do is we are giving you the technical support to ensure that we can, rather than going into the development, all the templates which we are offering, whatever data which you are sharing, it should be authentic. Again, I'm talking about authentic data, so that once that authentic data is shared with us, we will be helping you configure that data onto your application so that we can give those applications in the shortest possible time. So these are the different solutions which we offer. So you can very well monitor your different cases. You can also track the impacts. You can get updates about your school, about your government buildings. You can get to know details about your inventory. You can also share the information with public. Then there are different apps which can help you for different departments, like people who are only working with human services, who would like to understand the facilities, the places where the testing is being done. If you want to understand that, then there can be user-specific apps which can also be configured. These templates are there with us. There are 100+ templates which are there, which can be just by simple configuration. They can be given to a particular user or to a particular department so that that department can use that information for their use and they can help the community. So these are some examples of that. And once we have done this, once we have created this stuff, once we have enabled that, what we can do is you can actually see it on through your screen, that this data can, depending upon the kind of users which are using it, it can be your schools, it can be your medical health facilities, it can be your testing sites, it can be your people who are there in the field who would like to use it, it can be your GIS professionals, it can be other human staff, other people who are actually in the field who would like to use it. So whichever user it is, any person can use this kind of data, and this data can be shared. So this is the offering which we are going. So what I would do is now, since we have talked about it, I would just like to show you some of the cases which we have, how we have enabled them, so that you will be also having some, using my demonstration, I can help you show what kind of offerings we are giving. So this is the first site which I would like to walk you through. So the URL which I had shared in the starting, if you click on that, you will see that Esri India is offering you a place where it gives you, once you click on that URL, you will be this will be the landing page which will come for you. These are the different templates, the dashboard which we had configured for NDMA. I will be also walking you through this. Then there are some agencies with which this data can be shared. You can analyze your data, and then you can share your data. And at the bottom of the stuff, you will see that there is a button which talks about request assistance. When you click on request assistant, it goes to this page where you need to provide your details for customer and the other details, and you can fill up this request. If you have some challenges filling up this, you can always come back to Esri India, and we will help you fill this form for you. And once this request is given, we will also be asking you about the data sources which you have, which you would like to share, what kind of help you would like to take from Esri India. So once you click next, at the bottom of the screen, you will see that there is a next button. Once you click on next, you get to know there will be few questions like this which will be asked. Once you update that information, Esri India would come back to you, and they will be enabling you to configure data. So this is the request form. Now the dashboard which we are talking about. So let me first walk you through some of the global dashboards. The first dashboard which you are seeing is a WHO dashboard, which is again public. Here you would see that the number of cases which are here are a little bit less than the number of cases which are here. So here what they have done is WHO and the JHU University, the number of cases. For JHU University, it takes the cases of confirmed cases plus presumed cases. So here it's more about the confirmed cases, which talks about the total number of deaths. It's also talking about the number of cases which are increasing. So this is, I would say, a more of a world level dashboard. Apart from WHO, we have also at the global level worked along with JHU University, that Johns Hopkins University, where we have tried to take all the data. This data gets updated on regular basis, and it gives you the date and time when the data gets updated. The dashboard which we are sharing is a dynamic dashboard. The benefit of having these dynamic dashboards is that suppose I want to have information only related to Italy. I just click on Italy. What you will see is that the details for Italy is getting updated on the right-hand side. And on the lower bottom side, you can see the total number of confirmed cases which have increased, and total number of daily cases which are increasing on daily basis for Italy. As soon as I go from Italy to Spain, what will happen is you will see that the number of cases for Italy might have gone down, but for Spain, they are still increasing on a number. So it's a daily update which is happening on regular basis at global level as well. Now, apart from talking about the global level, the initiatives what Esri India has done is, the first initiative is the dashboard which we had enabled NDMA with. Here you can see the details which are getting updated on the total number of confirmed cases, total number of recovered cases, the total number of deaths. Then the confirmed cases based on the percentage they are increasing on the state-wise, the total number of cumulative cases. Here you can also see the date-wise data. And for each particular state, what are the number of cases which are increasing on daily basis. Apart from that, this is at the national level where we had worked with NDMA, where we had tried to take the data from ICMR and update that information onto our dashboard, and we had helped NDMA with this kind of a dashboard. Now, I would like to move to some of the states. We have taken the initiative, as I told you, that since last 3-4 weeks, we are working very closely with state departments, where we are taking all the details from the state department, and we are trying to update that information. So the first dashboard which I would like to show is J&K dashboard, Jammu and Kashmir, where we had worked with the Department of Ecology, Environment and Remote Sensing. Here you can see the total number of people who are being quarantined, the total number of surveillances, the total number of sample collected, the total number of reports. And here, if you want to have information related to each particular district, I can very well click on that particular district and I can have information related to that particular district as well, which is getting updated. And if I want to have details of whole state, we can very well get to know the details of the whole state as well. And here at the top right, here we have also given you an option where all the health nodal officers which are there, who are the nodal officers, what is their contact number, whom you should contact in that particular district office, all the details are getting updated. And if we want to go to a particular district level, we can click on that district level and we can get to know the details of that particular district. So, and here it's giving you the details of total number of active cases in the district, total number of confirmed cases. So this is again a dashboard which we had done for J&K, Jammu and Kashmir. Apart from that, we had worked closely with PHE Department of Maharashtra, where we had tried to create the dashboards. Here what we can see is that again the total number of cases in different districts of whether it's Pune, whether it's Thane, you just click on it, you get to know the details of that. You can see the date-wise total number of at the top, at the bottom right-hand side, you can see the total number of date-wise positive number of people who are increasing on daily basis. How these graphs are actually helping you is you can actually know the number of rise which is happening in a particular district or in a particular state on daily basis. So based on this kind of data, this will actually help you to define what are the decisions which organization should take to ensure that we should not be going into the stage 3 of community spread. So we can very well see these dashboards which are important, and when this data is getting updated, it is giving you the details for when the data is getting updated. You can also find details for Thane as well. Apart from Maharashtra, we had also worked with Punjab, where we had tried to see the total number of cases which are rising. We can help you define your I will just click on, let me click on Punjab dashboard. It will give you the details for Punjab as well. Here we are trying to give you the heat map, the kind of, so I'm just trying to show you different templates which can be easily configured, which can be used for in different ways where we can help. So it is here, it is giving you an option where you can see the different kind of heat maps where the number of cases are increasing in Jalandhar, in Amritsar, in Hoshiarpur, and then we can have point level data which gives you information of health facilities. You can click on the health facilities, you can click on the kind of patients which are there. You can get to know the details of each and every patient, when he was suffering, when he got this particular disease. So all this information is getting updated. How many people are getting quarantined on district-wise. You can have the district-wise information for quarantine data. You can have a trend graph analysis. What are the number of cases which are decreasing? How many deaths are happening? So again, this is an example from the Punjab, which we have done. And apart from these states, we have also worked with other states as well, where we have ensured that we have helped those departments to share these dashboards, to share these templates, and Esri India is trying to ensure that during this period of pandemic, how we can help your organizations to share your data or with the public or with any other department. With this, I would like to, apart from this, I would just like to add one more point is that apart from that, we have got something called as Living Atlas, where the data is available with us. That kind of data can also be taken, where you will have details of different administrative boundaries, which is publicly freely available for you. So that we can also help you configure that. That data can also be configured with your applications to on top of the templates which we are trying to configure for you. With this, I have come to the end of my presentation. If you have any queries, you can please ask queries.